name is Julie Burnett, and my speech topic is Parkinson's disease. I'm going to start off by showing my outline and go over what I will be talking about. I'm going to describe what Parkinson's is, the symptoms and the treatment, the causes, and also the clinical trials that are being done. You may ask, what is Parkinson's disease? It is a disease of the nervous system that affects the nerve cells in the midbrain to die. And these nerve cells are known as substantia nigra. Once the nerve cells start to die, there is a chemical in the brain called dopamine, and this will reduce the production of dopamine. And dopamine is necessary for smooth muscle movement. And without dopamine, the brain cannot send messages to the rest of the body, and so therefore there will be a loss in muscle function. Parkinson's usually affects the age group of 50 and above, but is known to affect the younger age group also. This disease is chronic and progressive, and it is a motor movement disorder. This means that the disease only worsens over time and does not get any better. There are no known causes, and statistics show that there are about 50,000 cases reported annually in the United States. It is important to raise awareness of what the disease is and what it does to the person, because once they find out that the disease is incurable, they may develop depression. The symptoms of Parkinson's is tremors, rigidity, slow movement, instability, and shaking of the hands, arms, legs, and jaw. Also, as an early onset symptom, there is slurred speech, and the symptoms do not go away, they only worsen over time. I'm going to show you a picture of what a person looks like with Parkinson's. You can see that he is slumped over, and usually his head and his hands would be trembling, and also he would have a slow movement, which will cause instability. To diagnose Parkinson's, there's a drug known as anti-Parkinsonism drug, and this will show if the person has it or not, and also brain scans, such as MRIs and CAT scans, that can tell if the person's nerve cells in the brain are deteriorating. There is no cause and no treatment, but research is being done to see if there are pesticides that may onset the disease. And since there are no treatment, there are medications that will be given to relieve symptoms, and also therapies that can be done. The medications are levodopa, which helps with slow movement and rigidity, anticholinergic, which helps with tremors, and also there are some drugs that play the role of dopamine. These drugs are bromocriptine, pramipexole, and robipinol. There are also surgeries that can be done, such as deep brain stimulation, and there are also pulse generators that can be put on the brain that will help with movement and tremors. There are also physical therapy, speech therapy, and occupational therapy. And a person can go to a physical therapist to help with their instability and balance, and learn exercises that will help them to be able to move better. Also, speech therapy and occupational therapy can help with the person's slurred speech. There are research being done on how the disease progresses, and they are using animal models to see how it will progress over time. They are also testing medications that will reduce the progression and delay it. They're also researching toxins that may trigger the disease, and also genetic factors, such as the past genetic history, and if there has been any Parkinson's disease in the family. In conclusion, there are some lifestyle changes that can be performed, such as a change in the diet, because the person needs to have a good nutrition. They may exercise that will help keep their muscles strong. They may avoid stress, see a physical therapist or a speech therapist. And also there are things such as putting up railings around the house to help so that the person does not fall and create further injury. And they may also go to group counseling to help cope with the disease. And also the person You need to know what the person is dealing with so that others around them can help the person cope with the disease. Thank you so much for your time.